about access-friendly mechanisms for uninsured patients. Today, MOPH is channeling patients with chronic diseases towards its primary care centers. In your opinion, I think you mentioned it is a good solution. However, we know we do not have currently evaluating mechanisms to evaluate the level of services that are provided. We know we don't have any governance. So, in your opinion, who would be the best body to measure the performance of these primary centers to build on trust within the public system and the Lebanese community?
Thank you, Celine. I think that among all of the healthcare components in Lebanon, probably primary healthcare, especially in the last 5 years, is the most organized, especially the one in the network, right? Because Lebanon has 700 or 800 dispensaries, but the ones in the network are 250. So those are the most organized. They have an active accreditation system, and they have a good overall monitoring system. So in primary healthcare, I don't think it should be a worry. The area that really needs quite a bit of restructuring is hospitals. Hospitals Lebanon is a disaster when it comes to hospitals. Some of them are not more than dispensaries.
Okay, so you are at ease with the performance of the healthcare workers that are located to serve the Lebanese community in these primary centers?
The word at ease is a strong word, but I'm more comfortable with them than other sectors within health.
Okay, my next question will be to Dr. Nikos. Are you still with us?
Yes, of course.
You mentioned so many actions that can be done to reverse the meltdown of the healthcare system, in addition to sharing that better health is more wealth. You did not mention anything related to preventive medicine as an effective tool to reduce healthcare costs. Did Greece entail this approach in their reform plans? And what was the main pillar, the surgical element you spoke about, that made the highest impact on the system in order for it to be most efficient and improve its outcomes?
Yes, I will start from the last one. The most effective intervention we did was the fixed budgets, the clawback. So basically, we fixed the budgets, and we were able to control the financing of the system. But financing is one element of the system. The other intervention we did, and it was quite successful, is electronic prescription. So we spent at the beginning of the healthcare system, of the healthcare reform, a lot of time to introduce an electronic prescription system. So subsequently, we were able to control the cost, the quality of care, the outcomes, the volumes, and we used it as a tool to rationing the healthcare system. But to answer the first question, one of the areas we failed was primary care, preventive care. This was public health. This was an area we failed. We focused a lot on the hospital sector, which was very costly, and that's why I really liked the proposal for the reform in your country, because it started in the first pillar by giving emphasis into primary health care, public health promotion, and also access of the uninsured and the vulnerable people into the healthcare system. I think this is actually a true priority, and then the rest can come.
Thank you, Dr. Nikos. Well, the well-to-do people who have the insurance, I think they can manage. So we have to worry about the uninsured. My third question will go to Lieutenant Abdo. As a military hospital, there is a solid collaboration with the private sector. And this entails additional expenditure on the Army's budget, definitely. What are the tangible actions that you are discussing to limit these referrals today? And are you entailing developing in-house solutions to cater for your community?
Well, definitely. We increased our capacity at the military hospitals. And we accentuated our rationalization processes like we did in the PCR. So we centralized the sampling, the test, and we decentralized the sampling procedure. So every PCR will have to come to us, but the value perceived by the patient will not change. So he will have the PCR taken at the place near his home, but we have a pooling of personnel because we couldn't expand our personnel to all over Lebanon. We centralized the testing. This is an example. And what we did in the military hospital, we took part of Rafiq Hariri Governmental Hospital and we managed it. And we took part in, during Corona and we allocated almost entirely to COVID-19 Lebanese Canadian hospital without any additional expenses from our personnel also. And this decreased the hospital bill.
Okay, so you are a great believer in centralization.
No, actually, I wasn't until this
You
crisis.
tested that.
But we have to have a duality. We have to centralize decision making, but we have to decentralize care.
Okay.
Okay, one with the other. This is my belief.
Now, my last question would be to Dr. Dabbous. Dr. Dabbous, looking at value-based care, what would be your best advice to ensure during this transition how we can deliver the best value-based care to our Lebanese community?
So value-based care, value-based pricing is on the mind of everyone, not only in Lebanon, but abroad. I think the trick there is to define what value is for a specific procedure, product, etc. I think when it comes to value-based care, it's very important that we understand where we want to spend the budget that we have. As for each condition, we can make the case that this is value-based. And I hate to say that we need to decide between conditions, which one goes first. But I think in terms of managing a budget, that we have buckets to treat urgent versus chronic versus oncology medications. That's where we have the need for not only financier experts or financial experts, but also to healthcare experts. Shadi touched on some proposals where we look at the needs in certain regions and geographic. That is value-based care, right? But when you implement telemedicine, wearable devices that you could communicate with the patient and pay less for a better outcome, that's a value-based care. Similar to hospitals. Do we need to hospitalize someone for, let's say, appendicitis for a week in a hospital? That's not value-based care. That's just wasting money and abuse of the system. So we need to look at what kind of infrastructure we have, expertise we have to define the value-based care. I'm supportive of that. I'm supportive to look beyond just the care, the devices, the pharmaceutical. We talk about value-based drugs. Why not doing it here in Lebanon? So I think I'm all for that. One thing that came across today is we need transparent ways to not only monitor, but to continuously reassess and see where our money is going. And that will help ease lots of the issues. I think we need to be creative and go at this in a stepwise fashion to what brings the most value to the money we spend and starts from there. So value-based care is something that everybody's looking at and improving. There's no common solution to that as value is in the eyes of the beholder.
Thank you. With that question, I end up the Q&A. Do we have any question from the public?
My name is Fadi Alemi. I'm a member of parliament in the healthcare committee, plus I'm the vice president of private hospitals in Lebanon and also the president of the Arab Hospital Federation. So I think I can cover the whole thing from so many aspects as a legislator moving forward into the technical parts of this business. What I want to do is just talk a little bit about the universal health coverage. So I know it's a long-term plan. It's been an issue that's been debated. There's a draft law in the parliament, and I've heard about this law ever since I came back from the US long time ago, and it's stuck in the finance committee now, looking for funds and looking for ways to govern that specific scheme. But this is actually the only way out if we're going to offer accessible, equitable care for the poor and the needy in this country. And it's doable. You spoke, Dr. Salih, you spoke about the primary healthcare system network that we have. And thanks to the international donors, because they contributed a lot for that system. And I think they've about to start implementing, or they've started to implement electronic medical record system, which is a prerequisite for any universal health coverage. So that's a tool which is available. We have not seen them acting as a gatekeeper. That's the reason why I have inflated healthcare costs. Being a shareholder and a chairman of a hospital myself, a private sector hospital, I see so many people coming into the hospital where there's no need for them to come into the hospital. So we have to act like in the US. I've seen it happening a lot. So many insurance companies, they've mandated that you cannot walk into an emergency room. You have to go through a preferred provider, or you have to go through a screening system to a gatekeeper, a family practice, where you get screened. And if you have to go to a hospital, you go to a hospital. So that's one way to cut down on costs and cut down on the redundancy of services. The other issue that we have is really getting our public hospitals in a better shape. Now, politics play a lot here, and that's why I'm a big proponent of the PPP system, having the private and the public sector under a law that we have in Lebanon, which we don't use, unfortunately. But we need to utilize this law, build that partnership, reduce expenses on the side of the government, get the private sector to be involved in managing and assisting the government. And I think this is where we're going to see a better healthcare system across the board. And then, by then, you will see so many of the private hospitals leave the market. They're going to close down. There's no way out for them. It's either they're going to have to compete, they have to improve their quality of services, and then they have to really take part and be ethical in the way they do business. Unfortunately, it's not the case nowadays. So I love the proposal that you've mentioned. There are other hybrid proposals also that can work in parallel. We need the will to do that. We don't have the will at this point. Unifying the private schemes, the public's guarantor schemes is a big issue. It's been debated over and over and over. I have no clue why the Army has its own fees and then the Social Security Fund has its own fees. I have no clue. It's the same service that's being rendered in every single hospital. Why the Army pays less for certain services at the expense of, let's say, the internal security forces. So these are things that we can probably work with immediately now and hopefully try to get the system to work at least, or to wither the anxieties and the economic collapse that we live in until we are ready to move on and utilize systems as the one that you proposed. Thank you.
Yeah, hi, my name is Nisreen Masri from Social Worker Syndicate in Lebanon. Actually, I have two things to talk about. First, if we can focus على الصناعة الداخلية هون للأدوية, if we can focus on manufacturing the medications here. أول شيء نحن عم نعزز الاقتصاد. يعني هيدي المعامل are hiring more people and hiring وهيدي الناس عم تقبض وهيدي vicious circle بنبرم فيها بتقوي العجلة الاقتصادية هيدي شغلة. وبعدين why not؟ ما نحن يعني sorry نحن we are very clever and very successful outside Lebanon. Why we are not in Lebanon? We can do a very good product if we want. All right, we have to have a good system of quality assurance and quality audit. Otherwise, you cannot trust the product that is manufactured in here. الشغلة الثالثة نحن بلبنان unfortunately بوزارة الصحة I haven't seen anyone of وزارة الصحة they do not have سياسات preventive policies or preventive measures before المشاكل تصير. يعني نحن أكثر expenditure عندنا بالوزارة شو هو؟ أمراض السرطان. Alright. إذا نحن we do the math between doing the preventive medicine اللي هو do the صور أو فحوصات أو whatever campaigns عم ينعملوا for let's say the cancer and between the medications أكيد the expenditure is much less. So we should focus on both. We have to focus on manufacturing the medications and we have to focus on preventive policies بلبنان. I think بكتير مننزل expenses تبع المedications. كمان شغلي we do not have an audit, a proper audit. Unfortunately, people in Lebanon do not trust the system. Okay, that's why we have to have a proper audit. واللي حكى حضرة الدكتور فادي كتير مزبوط انه نحن هون عنا تسعيرة معينة، وزارة الصحة عندها تسعيرة معينة، الضمان عنده تسعيرة معينة، البرايفت hospital I don't understand why. It's the same service. All right, so we have to focus on helping and getting more investment in medicine business and preventive measures. Thank you.
Thank you, Nasreen.
Of course, I agree on most what was said on the transitional phase. If we have to talk about the health policy, بعتقد most of what was said was mostly on the illness part of whether primary healthcare, secondary or tertiary. And I think this is for a later stage لحتى نحكي عن preventive as in a holistic approach, and this needs a whole of government policy making in an interconnected way. نحن بنعرف إنه wellness and good health is related to the water. هلا خاصة we're suffering from water, from malnutrition, undernutrition, the quality of the diet, maybe the road safety, the air that we're breathing. So long term ما بعتقد فينا نحكي عن universal health coverage unless we have a real transformation in the policy making and the interconnectedness of the policy making and also in the budgeting for the policy making. And this needs a complete different approach to the policy making where we have the center of our policies should be our citizen. طبعا هلا talking about the hospitals, public and private sector, بعتقد صحيح نحن عنا prior to the COVID-19 كان ال private sector mostly was working, بس هلا we have to ask the question, the private sector, was it really private with most of the public spending going into the public hospitals? So this has to be also reviewed, and as was mentioned, طبعا the standardization of the procedures of the policies in the public hospitals, كمان public hospitals have to be reviewed. أنا بحب ألفت النظر to a very crucial, important element. Without it, we cannot go anywhere, I think, in a very effective, cost-effective way, transparent here, the importance of digitization. Digitization can help us first have the data, analyze the data, collect the data, real-time policy input for policy making. And digitizations cannot be done in a fragmented way like it's being done now, لأنه we will end up in few years' time with the digital issue, we ended up with the waste management issue. Every institution or every part of Lebanon is doing its part of digitization. But هون it's very خلينا نقول it's going to be very costly and very chaotic, because if we don't have one set of really very solid data, national data for the citizens, we will not be able ولا نعمل أول شيء we will have problems with the identity, ما راح يكون عندنا transparency and governance, بس كمان we will not be able to form national policies. And this is something I think we صحيح نحن بالAUB بس AUB also is a policy policy making policy into نتأمل إنه تصير knowledge into policy to push for a national strategy for digitization, لأنه without it we will not end up where we should end after this multi-level collapse that we're going through. Thank you.
Thank you.
So, talking about digitalization, I cannot but interject here. Nothing works. I mean, France, many years ago, they decided to digitalize the country. By doing so, their GDP was going to go up, I think, by 1%. So imagine the amount of money. Look at our neighbors to the south, the Israelis. They're digitized everything they're doing. Lebanon was given an amount of money for digitalization in the healthcare sector many years ago. Didn't go anywhere. And that is something that we wanted to do for Lebanon, but unfortunately it did not happen. I think there are lots of opportunities to do so, and what I mentioned in the digital health, that is one of them. Without having a system that collects data to understand what is happening today and how to prioritize things, where to focus money, infrastructure, education, etc. Yeah, exactly. And we're not going to go anywhere. This question of confidentiality, and we don't want to know the name of this and the name of that, who cares, right? In the US, everybody talks about confidentiality. The healthcare record for each patient is the property of that patient. And everybody has the right to carry it. Now, people don't know this, so insurance companies take advantage of it, right? But this is something that must be implemented. If we want to move from the mess we're in to a future Lebanese healthcare system, that should be the first thing to be done. Without this, you cannot do audits. The proposal was digitalization. Why? It's to ensure that patients are treated according to guidelines, to protocols, that there is no abuse in labs, no abuse in imaging, no abuse in referrals from Omar to Habib to Shadi, so everybody can make money at the expense of a poor patient, right? So I applaud you for this.
For policy making and also for anti-corruption, for transparency and for efficient.
Thank you, Dr. Dabbous. Thank you, Dr. Ainaya. By that, we will be closing our panel discussion today. Thank you all for attending. It was a pleasure.